Burnout in healthcare is a serious problem in the current day medical profession because it affects every aspect of medical care, including the patient care, the individual providing the patient care, and the organization and every aspect of care. The scope of the problem is pretty extensive. Almost 50% of the healthcare professionals, the nurses, physicians, nurse practitioners, social workers, they're all burnt out in the current day medical practice. So if you look at what is burnout, it belongs to a spectrum of diseases called work-related distress. What it is essentially the individual, the medical staff, becomes deaf to life and to surroundings. I came up with this mnemonic called DEF, just to remember it. DEF stands for depersonalization, emotional exhaustion, and then functional performance, a decline in functional performance. So DEF is what happens to the individual, individual being the individual healthcare professional, whether it's a physician or a nurse. So why is this important to both from a patient perspective, from the individual perspective, and also from the organizational, which is the hospital or the clinic or the university setting where the individual is providing the care. If you look at what happens with the distressed staff member or a distressed medical provider, studies have shown that a burnt out medical provider who is experiencing burnout is going to provide lower quality of care, it's going to commit more errors, and the patient satisfaction goes down. So this costs the organizations in many, many ways. One is you may lose the healthcare provider because either through early retirement or could not sustain the stresses of the job, or you are left with poorly performing staff. So it's going to cost heavily the organization. So now, who is responsible for burnout of the medical professionals in healthcare? There is not one individual. It is not a single cause problem, and it is not a problem of the individual definitely, because if you look at the fundamental unit of how the medical care is provided, if you go to the bottom, if you go to the very basics of it, you will see that there is an individual who comes to a professional seeking for help, right? So it is this interaction, this communication that goes between the individual seeking help and the professional providing the help. So for this communication, for this interaction to go efficiently, a whole ecosystem is created around it. The ecosystem consists of the physical ecosystem, which includes, for instance, if the patient is not so sick, he could be or she could be treated, or then interaction happens within a clinic. But if the individual is so sick that cannot be provided, the care cannot be provided in the clinic, then this physical location would be a hospital. Or if the individual requires a surgery or a procedure, then it has to be done in a facility. So the first ecosystem that is built around this communication starts with a physical location, which is a clinic or a hospital. So for this hospital to run, you need staff, you need administrator, you need clerical staff. So this is the ecosystem of the immediate ecosystem that happens around, that is constructed around this communication. And then you go up the ladder, you have layers and layers of complexity that is built in this huge ecosystem, which is the medical industrial complex, I call it. So the organizations and the people involved in this ecosystem comprises of insurance providers, industries such as pharmaceutical industry, equipment making industry, device making industry, or companies. And then you have regulatory agencies who is policing all this. and you have nonprofit organizations, you have governmental agencies. So you have all these people whose function is to ensure that this basic unit of communication between the patient who is seeking care and the professional who is providing the care, this communication happens efficiently and effectively. This is all the purpose of the entire ecosystem. But what happens when the ecosystem crushes the professional who is actually providing the care? That is when burnout happens. And therefore, the cause of burnout or the causes of burnout is not one person or one organization. It is the collective effort, or it's a collective cause of the entire ecosystem that is bearing down on the individual. So if this individual is crushed under the weight of all the regulations and the rules and policies and everything that is imposed on him or her, who suffers is ultimately the patient, and the organization suffers. And therefore, it is important that we identify there is such a thing happening in the current day medical profession. 30 years ago, there was no term called burnout. And not that it did not exist, but it is probably there, but they used to call fatigue and stressed and frustrated, and you get a break from your routine, and then you're back and back to your job, and most of the time you're relieved of your stress and frustration. But with the current day relentless pressure from so many angles, from so many levels on the patient and the provider of the healthcare, it has become a constant nagging problem. So one question arises is burnout same as stress? So we have seen what burnout is, what the experts define it as: depersonalization, emotional exhaustion, and poor functional performance. What this actually translates to is, before I answer this question on whether it is stress and is stress same as burnout, what this translates to in common terms, in normal language, is that the individual feels like he's, or the professional feels like he's tired even before the start of the workday. So even if that is number one problem there. So if you feel like I'm already tired even before my workday starts. Number two, if I feel like I have no patience for to talk to the people I am about to serve, then that is problem number two. Number three is I'm committing more errors of judgment despite adequate training. If you're having this collection of these symptoms, you're already burnt out. So stress is a different animal. Stress is when your reality doesn't meet the expectations. So what happens is stress, most of the time you can identify the cause of the stress, and if you fix it, you can see immediate results. And also, if you feel like you are fatigued and stressed out, you take a break and you rejuvenate yourself, you're back to, most of the time, you're back to functioning normally. But burnout doesn't happen like that. Despite getting adequate rest, despite taking what you might think are adequate measures, you don't get any relief. And that is the nature of burnout. And another problem with burnout is it is not an illness. It doesn't fit in any diagnostic criteria. And so if you go to a psychologist or a psychiatrist, they may not be able to identify this because this burnout manifests itself as so many psychiatric illnesses, such as depression, anxiety, insomnia, and even borderline personality disorders, and even other spectrum of other psychiatric illnesses. So if you go to a psychiatrist or a counselor, because they did not have a definition of burnout, and there is no such diagnosis in either the textbooks or in the manual of diagnostic and mental disorders, at least for the time being. So it is very difficult to diagnose it, leave alone offering help. So the onus is up to the individual and the organization in which the individual is working to figure out what is happening to the individual so that it doesn't end up in early retirement or quitting the job or losing friends and losing the job itself. So it's important to recognize what burnout is and identify how it is different from stress. So one question that was frequently asked is, I'm successful, so am I immune from burnout? Successful people, they have research have shown that successful people actually tend to work more, take that extra mile, and therefore they are more susceptible to burnout. And so success does not protect the individual from burnout. In fact, they are more prone to burnout. So one has to recognize this. Now, how can organizations actually help or take measures to make sure that the individual professional or the staff member is either not getting burnt out, or if they're already burnt out, how do you ensure that you help them come out of the distress? So it all starts with effective leadership. Once you have the effective leader, how do you move forward in ensuring that this issue of burnout is being curtailed? It starts with understanding the culture of the organization and taking targeted solutions to this. For example, if you implement a new regulation in the workflow, electronic medical records have been shown to be one of the major causes of burnout. And let us say there is a new regulation that has to be put in place. And the leader has to ensure three things before this regulation has been put in place. One is this new task or regulation or new responsibility actually going to help the target population? Either it is the patient or whoever this is intended. Is it really going to help? First point. The second one is, do we have enough resources and manpower to implement this? Without ensuring that enough manpower and resources are in place, you cannot implement the solution into the workflow. And the second is, how do I measure progress? So unless you have these three elements in place, you cannot even think of implementing. So an effective leader obviously going to take all this into consideration and implement this. And then the second most important, all this is again from Mayo Clinic. I have gathered information from Mayo Clinic, and they have provided several steps, and of those I picked few that are important for burnout in major healthcare organizations. Point number 2 would be to cultivate community within the organization. So unless the staff is supported with adequate means of a dialogue that goes on between the leaders and the actual skilled providers, so this problem is not going to get solved. So providing or ensuring adequate community and support system becomes very important. The third is to ensure that there is adequate work-life balance. For example, is the organization providing enough break time between shifts? Or if it is a nurse who is getting burnt out, what is the optimum nurse-patient ratio? If it is the physician, how much time am I giving for each patient? And how am I rewarding for the triumphs or the successes that happen on a day-to-day basis? Because when you're in medical school or nursing school, the workflow is pretty much set. When the next semester is going to end, you know what's going to happen when you go to the next semester or next year. There is a reward punishment system that is already set in place, and you know when you're going to graduate. So once you're out of the school, medical or nursing school, then there are no set rewards set in place. So your reward is patient satisfaction. So if the organization can ensure that there are some built-in rewards, then that actually helps the morale and the satisfaction of the staff members. So all these come into play. In other words, the organization has to ensure that the time that is spent at work is quality time. Coming to time, let me bring one interesting thing that I found out. See, if you look at the number of hours available in a given week, the total number of hours, subtracting time for sleep, time for chores, time for daily activities, and things like spending a little bit of time getting to work, getting ready to work, taking kids to school and things like that. If you subtract everything, all you're left is roughly about 80 to 90 hours of active time in a given week. Most of the healthcare professionals work roughly about 45 to 50 hours in a week at their organizations, at their hospitals. So you look at how much time is being spent at work at your organization. You see it's about 60 to 70%, 50 to 60, or sometimes 70% of their time is spent at the hospital or at the organization. So if so much time is spent, apart from providing the salary and the perks, the organizations have to ensure that the time they spend is quality time at the organization. So all this comes into play when you are looking for solutions to burnout. So these are the organizational factors and the solutions. And going beyond that, you look at the policymakers. You have to ensure that whoever is making the policy decisions, either at the government level or at the industry level or at the professional organizations level, like American Academy of Pediatrics, American Academy of Family Physicians, Board of Internal Medicine, and the things like these professional organizations, you have to ensure that they are actually making decisions that would help this interaction, the patient-physician interaction, to go smoothly and effectively. When you come to the individual level, the solutions at the individual level, I have divided into three different categories. The first is to revisit the nature of your job. Why did you get into this job in the first place? Most of the people find meaning and purpose in what they do in healthcare. So go back to it from time to time. When you feel like you're getting burnt out, when you feel like you're getting frustrated with so many rules and regulations and policies that are imposed upon you, you have to go back and revisit the nature of your job. And sometimes you have to go out of your job and the profession to ensure that you can provide care and service outside of your profession. Sometimes you go to the local school and educate the children about healthy habits, quitting smoking, education about drugs, education about sex, education about relationships, and so on. So that would add more meaning and purpose to your job as well. Number two, I found, was again ties to point number one, which is finding balancing engagement and meaning. See, you may have a lot of meaning in your work, but if you're not engaged with the people that you're supposed to provide the service, then it doesn't balance out. Or on the other end of the spectrum, you may be well engaged in your job, but you don't find a whole lot of meaning in it. But you work there because of the perks of the retirement benefits you are provided, because of the perks you are provided, because of the job security in healthcare. If you work towards that end, then in the long run, you're going to get burnt out because you have not balanced meaning and engagement in your job. So the third point I found very interesting is, how do you manage your leisure? So, see, if you go to work, your workflow at work is already set in place for you. You know when to go, you know when it's going to end. You know what to do, and you know who to ask for help and if you need. So this is all, the workflow is nicely set in place if you're in a job that is well organized. But leisure is unorganized. Your mind doesn't know where to go, what to lean on, because you have not provided, you have not organized leisure around. So on the weekdays, you know how your day is going to go like, although there are some surprises and unexpected events that can happen at work, and most of the time you have support staff, where to go and who to ask and all those things. But on weekends or your time off, then your mind is looking everywhere to lean on. So you have to structure your leisure just like you structure your work time. People who have social activities, who have religious activities, actually they found that in research they are a lot more organized and they are more productive at work. People who manage leisure are actually more productive at work, and they are in most ways protected from burnout and job-related fatigue. So make sure that your leisure is also well balanced and productive and efficient. If you depend on hypersensitive exposure such as watching movies and TV and drugs and alcohol in your leisure time, it's actually going to have an adverse effect on your job. So taking these into consideration, you actually have to ensure that at an individual level you're taking all the steps, and at the organizational level your organization is taking all those steps. So it is a collective effort. Because we work in an ecosystem that has so many players, you have to ensure that solutions come from so many different levels. It is not an individual, burnout is not an individual problem. It is not because a person is weak or incompetent, but it is because of the weight of the systems that we have put in place. It's crushing the individual professional and hindering the fundamental unit, which is the interaction that goes between the patient and the healthcare provider.